In good news for Queensland overnight, there have been 0 new cases. That's wonderful news, but as we said yesterday, this week is very crucial. And of course, we want people to come forward and get tested if they have any symptoms. We still have 12 active cases, so that takes our total to 1,085. And in the last 24 hours, 7,482 people have come forward to be tested. I can also confirm today that all 105 residents in the Bolton Clark Aged Care Home at Pinjarra Hills have been tested. I think yesterday we said there was one person that hadn't been tested. The whole lot have been completed now and are negative. And I do want to thank Dr. Young for meeting with the families of concerned residents yesterday, and my information is that meeting went extremely well. And of course, these precautions are being put in place to protect our most vulnerable. So we'll continue to monitor that situation over the week. In relation to the Sunshine Coast Stadium, can I just address that issue? We've been contacted by the NRL this morning, and the Storm themselves are saying that they want to reduce the number of people to that stadium by 1,000. We do want people to adhere to social distancing. That is incredibly important. But Dr. Young will also address the fact that people are outside is less risk than being inside. But of course, we don't want to see large crowds gathering and not social distancing. The majority of people were seated, they weren't moving around. But having said that, I want to commend the NRL for taking that very swift action and letting my office know this morning that they will be reducing the numbers by 1,000. Of course, we want to see the NRL competition continue. It's going from strength to strength, and I just want to thank everyone for doing the right thing. The final comment I just wanted to make before handing over to the Deputy Premier is about overseas travellers. Of course, we had that situation the other day where the gentleman flew into Sydney and then transferred on a flight to the Sunshine Coast. I'm going to raise this at National Cabinet. I think now is the time for overseas travellers to definitely go into mandatory hotel quarantine. There have been some exemptions. I don't think the time is right now for those exemptions. However, that is going to be a matter for the chief health officers around the country to look at, and of course I want to put that on the agenda for National Cabinet as well. I just don't think we need to have any elements of risk at the moment when we're dealing with this global pandemic, and if we can close off any of those loopholes, it'll keep everyone safe. My job is to keep Queenslanders safe. We've been doing a great job. We want to keep that going, and we just want to maintain the lifestyle that we love here in Queensland. So if everyone does their part, and that means everyone's social distancing and washing their hands, and if they're sick, staying at home and getting tested, we will get through this together. I'll hand over to the Deputy Premier and then Dr. Young.
Thanks so much, Premier. This is exactly what I had hoped for over the weekend. A large number of Queenslanders getting tested and no community transmission, leaving us with just 12 active cases of COVID-19 in Queensland. One of our active cases is now considered recovered. They're in the Metro North region. 7 remain in hospital. We've now tested nearly 510,000 Queenslanders, which is a great result. We are seeing a slight increase in the turnaround time for tests as a result of that large number of tests coming through, and we'll be working today to address that. Our contact tracing has progressed well over the weekend. There are now just 10 remaining contacts outstanding, and our teams will continue to work to contact those people throughout the day. And finally, I'd just add to what the Premier had to say. The Storm have reached out overnight and this morning and indicated that they want to work with us to address the concerns from the game yesterday afternoon. I was watching the game, I saw what people are concerned about, and so we will work with them to ensure that social distancing can be maintained, even though, as the Chief Health Officer has outlined, the actual public health risks there were minimal.
So no new confirmed cases of COVID-19 in Queensland overnight, which is fantastic, particularly when we see the very large numbers of Queenslanders who've come out to be tested. And I commend every single one of them, because I know it takes time out of their day to do that. Although we've managed those queues much better, it still takes a while to come forward and get tested. And then it's extremely important that those people remain at home and isolate themselves until they get a result. So thank you to every single one of those Queenslanders who've done that over the last few days. The next week remains critical. We know it's now 8 days since those first 2 cases who went down to Melbourne and returned have been out in the community, but then we've had those subsequent 3 cases. So we could still expect to see some ongoing cases. So please, everyone needs to be very, very careful. If they develop any symptoms at all, to immediately come forward and get tested and isolate themselves till they get the result of that test, to maintain social distancing as much as they possibly can. And everyone, please reconsider whether you need to travel to Victoria or that hotspot in New South Wales, metropolitan Sydney, or overseas. Those are all very high risk environments that you could contract the infection and bring it back into Queensland. So in Queensland we have 12 active cases today, which is a great place to be, but we know that one case, if it's out there and out about in the community, could rapidly lead to a lot more cases. So it's time to be really vigilant. Now, I just wanted to comment about the football match that happened up on the Sunshine Coast. I think people responded really well, but I do think we need to go and review that, because it is hard to maintain social distancing when you're sitting on the ground. And I saw people were trying to do that. They were on separate rugs for separate household groups, but we will just have to have another look at that. And the NRL and the venue managers have been fantastic in working with us, because everyone wants to make every encounter out there in Queensland as safe as it can possibly be. So if everyone can also themselves think about how they can make themselves as safe as they can be, because ultimately we want our society to keep going as much as possible. We want our schools to remain open. We want our shopping centres to remain open. We want our sporting facilities, everything. So it's important that everyone does what they can to reduce the risk to themselves and their families. And again, I ask people, please, could you download the COVID Safe app? It is a really simple thing to do. I did it right at the start. You then can ignore it. But it means that if you come into contact with someone who is positive, you can be told much more quickly that you've come into contact with that person. So I think it's a really important thing for every single Queenslander to do. If you could all do that today, that would help. At this point in time, we have plenty of contact tracers, so we can do that work. But we know that sometimes people have been in contact with someone and they won't know their name. This way, we'll be able to get that information and make sure that happens. And then I'd like to comment about that Bolton Clark facility in Pinjarra Hills. They have done the most fantastic job. They were onto it before anyone contacted them, because they were planning, and they've had their plans in place back since February, and they've enacted them all. So even before they knew that they had a staff member who had tested positive, before they knew that, they'd already started working in their facility how they could minimise any risk. So then when they got the phone call, they could immediately put it in place. And I've asked all of our aged care facilities in the southern part of Queensland to think about what they can do, and they've all risen to the challenge. So that's really important. I do recognise the impact on the residents by not being able to have visitors. That is really, really hard. And as soon as we can remove that restriction, we will. But I am very, very concerned about all of the residents in our aged care facilities across Queensland, because they are the most vulnerable group in our society, and they are the ones that we all have to protect the most. So it's very, very important we do this. Thank you.
Good morning, everyone. First of all, I'd just once again like to thank the community for their patience, not only the testing lines, but also on the border and trying to get into our state with the incredible delays that we have had. But I do want to comment on Friday. Obviously was a difficult day going into Saturday with the lines coming back into Queensland at our borders. That improved dramatically on Saturday, and yesterday it was a lot better again. So constantly improving as the day goes on. We saw 4 people issued with notice to appear for offences for either unlawful entry to Queensland or making a false declaration in the last few days. A further 3 remain under investigation for these type of offences. And you recall I commented on the fact that these people will not be issued with infringement notices any longer. It will be a notice to appear. We are taking a very tough stance on this to ensure that these people appear before court if they actually make a false declaration on their border passes. We are also conducting a further blitz on people in home quarantine, and whilst we do auditing on this throughout the week, we will be doing a 100% compliance check in the next few days. And this is not just the normal auditing that we do, but also followed up with personal visits. We have seen in other areas that compliance has not been good in this area. I can say that Queenslanders have been exceptional throughout all of this, and our compliance is actually excellent. But just to ensure that we are constantly doing the right thing, a further blitz will be held on home quarantines. I just wanted to again make a comment in relation to what I have previously mentioned about community members making comments about cultural groups and ethnicities. This has been playing out in social media. It's not productive, it's not fair, it's not Australian, and it's not a Queenslander thing to do. We have been actively engaging with the African community to support them during this time, and please, this behaviour is counterproductive to social cohesion. And I mentioned again and will that these groups, all groups, need to be coming together through this very, very difficult time. And if we do find people that are conducting offences because of this, we will be taking action against them. Once again, we are assisting Queensland Health with those long queues, which have actually, the time has decreased dramatically, but in terms of patrolling those lines and conducting our traffic management plans around them as well. So please be patient when you're getting tested at those clinics, as at the end of the day, it is a community safety issue. As always, social distancing, good hygiene, and please stay home if you are ill and get tested. Thank you.
Morning, everyone. So just to add some detail to what's already been discussed by the Commissioner and other people here this morning, we saw over the weekend that at our borders since Friday, 152 flights have come into Queensland that we've checked. That equates to 11,494 passengers physically checked and their bona fides checked against their entry with their border declaration passes. 188 of those in the domestic airline have gone into quarantine. At our roads, we've seen 17,710 vehicles intercepted, 208 people refused entry, and 84 placed into quarantine. As the Commissioner indicated, things are improving as we hope they would. In particular, we're very pleased that on Thursday we sent out 90,000 push notifications to people that held border declaration passes. That has absolutely assisted in terms of streamlining the process, so we're quite happy that that's worked well. With respect to the notices to appear, we have one person who came through in a truck that was located in Gympie that has been issued with a notice to appear, and further aspects of that remain under investigation. The other 3 were 3 at Wollongara attempting to get into Queensland. They were given notices to appear for a variety of offences, including false declaration, falsely stating name and drug offences, and were turned around. And as the Commissioner indicated, 3 remain under investigation. We issued one on-the-spot fine over the weekend for a breach of quarantine. And as the Commissioner has indicated, we are doing 100% audits of all people in quarantine. There are 380 across Queensland at this moment in home quarantine that we will be checking in the coming period. Over the weekend, with respect to licensed premises, I think it's worthwhile mentioning that we checked across the state 906 licensed premises and only 1 formal warning was given. One particular venue in Brisbane took the proactive stance to close itself when patrons were not doing the right thing, which we find very encouraging, and thank all the licensed premises for the work that they're doing. Overall, the crowds were reasonable. As we've seen, there are still issues sometimes with people in lines outside. That risk is much lower. The venues are doing their best to try and control that, but we'll continue to work with them to see how we can improve that. Look, overall, I'd say to the community, realistically, fantastic work so far. Keep working with us on this. We're doing a great job of trying to keep this state safe right across the board, but it's not over. So that social distancing is really important. Thank you.
So before you go,
Sure.
can you give us more details on that fine?
No, this is one that's probably a historical one that we've checked in terms of our investigations, found this person had breached quarantine. It was on the Gold Coast, and they've been issued with a penalty infringement notice.
Can I just ask, maybe not too young like the one, did the Sunshine Coast Stadium reach any crowd protocols? I guess that have more people than they should have.
No, they followed them all, but looking at it, because it's not a traditional seated stadium with proper seats in it, I think it's a bit harder to maintain that distance. So if you think here in Brisbane you've got seats and they're allowed to have up to 50%, because that means you can have the seat in front of you vacant and you're all facing the same way. I just think it's a bit harder when you've got rugs on the ground. So I think everyone did the right thing as far as I could see, but remember there were actually 5 Queensland Health staff there, so they know exactly what happened rather than the footage I got of looking at the crowds. So they'll work through just how to make it a bit safer, because that 50% cap is better designed for where you've got formal seating, that you can actually say, because the problem here is with that hill, it'll be harder to contact trace people there because you can't say exactly where they were. But the venue did a great job. They divided the crowd into 4 different groups so that they could decrease the numbers in each group. So they did a good job.
Given the numbers who were testing the Logan and Acacia Ridge, Metro South area late last week, are you surprised there have been no active cases from there after 1 or is it too soon?
I'm not surprised. I'm relieved, but so we just have to wait and see. It is too early. The next week will be telling before we can really be completely relieved.
What are the delays that are being seen, and is that just something that people are going to have to wear as a consequence of the numbers that are getting tested?
It has increased. The turnaround time to get results has increased, and so we're going to do some work to see what we can do to reduce that. So whether No, we're seeing up to 31 and then more recently 38 hours. So rather than the 17 hours we were seeing. So it has extended out, which is why I thanked people earlier for their patience, because they do need to stay at home till they get that negative result. But yes, we're working through to put some more resources in there to try and improve those turnaround times and bring them back to that 24-hour turnaround.
Is the backlog in the testing capacity, or is it in the communications side of getting the results to them?
No, it's in the testing capacity in our laboratories. So we've got testing throughout the state, so we're going to look at whether we can use more of that, because of course today the pressure is on that Logan, South Brisbane area, not in the rest of the state to the same extent. So we're just seeing how we can work that through, and also we'll do more work with the private sector, because the majority of people for this particular round of testing have actually been coming to the public sector. So people could, if they've got GPs, go through the private sector. There hasn't been the same degree of delays there because they haven't had the same numbers present to them. No, it depends on what happens in the next week. So it really depends how many cases we see over the next week.
On the man who flew into Maroochydore, then I think he's quarantining in Toowoomba.
Yes.
Have we had any more people from that flight get tested, or do we have any numbers on that?
Yeah.
in terms of-
I don't have the numbers from this morning, but we were trying to contact 14 people who were on that flight.
And he's quarantining as well?
Well, he's isolating because he's a confirmed case. His wife is quarantining with him.
Premier, on that, you mentioned that some of it was taken from natural category.
Yeah, and Dr Young's going to raise it with the Chief Health Officers today at her meeting.
What is the issue of concern there? Like, what is the loophole, the point of concern that most volunteers?
Well, I think what we're seeing is more cases are happening right across the globe. So there's a higher risk of return travellers coming back into Queensland, and we just want to look at that those exemptions. So this person worked overseas in an embassy, so he would be granted an exemption. So maybe now's not the time to have those exemptions, as the number of cases are increasing.
Graham Turner's calling for, open everything up and just live with the virus. Do you think we might have an
Well, that's reckless. That is simply reckless. It would put all the good work of Queenslanders at risk, and that is something that Queenslanders definitely do not want. I can assure you they do not want that. I have been out in the length and breadth of Queensland, and Queenslanders are very happy with the way things are going at the moment. They do not want a mass opening to everything. You would have seen what would have happened to Queensland if that had happened.
Do you think the LNP can move on from their presidency problems tonight when they select a new one?
That's a matter for them. Obviously, they're focused on themselves.
Premier, the Queensland Chamber of Commerce and
Yes.
Industry has a survey that shows
Yep.
very low levels of optimism. Is there anything else the state can offer small business?
I think when you look at what Queensland has done for small business, our government has been front and centre of making sure that small businesses can get on with the job. With the payroll tax we looked at, we've also got our back to work for regional Queensland to help small businesses, skilling Queenslanders for work. There's a whole lot of measures there, but I think Queenslanders can have confidence that our economy has opened up when you contrast that with what can happen if you have a virus outbreak. So our approach has always been measured and responsible, but it's about allowing Queenslanders to function within Queensland, to make our economy function within this state. And, I think the big strengths of the Queensland economy have been not just mining and agriculture, but also our small business. And we know that shutdown really hurt businesses, but now that we have opened up Queensland for Queenslanders, the public are out there in droves supporting people, which is great to see.
The AFL Grand Final is increasingly unlikely to be held in Melbourne. An update on whether Queensland is hosted?
Yeah, look, that's a really good question. And look at the moment, I don't think we should be discussing the grand final. I think I know how much the grand final means to Victorians. I know how much Victoria is hurting at the moment. I think all of our thoughts are with Victorians at the moment, and at the moment we are focused on the competition, and if at some stage down the track there are discussions, we are happy to be part of those discussions, but they are premature at this stage. I think let's get on with the competition and let's discuss it at an appropriate time.
I mean, just on given we were cases just a few days ago, are you feeling more relieved?
Look, I don't think anyone can be relieved because we always have to be on our guard. And as Dr. Young said, this week is crucial. So we'll be monitoring everything over the coming week. But it is good news that today we've had 0 cases. But like Dr. Young said, that could change over the coming days. So it's up to everyone now. Everyone's got to do the right thing.
Just on the consular officials
Yes.
now, why does it need to be discussed at National Cabinet? Do you not have power to just simply say, consular...
I'm not in charge of the embassies. That's the federal government. Yeah.
The conditions under which people enter the state, you can't...
No, because they're coming back from overseas, so they would have a Commonwealth exemption. Yeah. So look, we're happy to have these discussions, and hopefully we can put it on the agenda.
So if there's not national agreement, then there's nothing further you can do on that matter.
Correct.
Just on
Yeah, but look, the National Cabinet's worked very well together, and where issues have arisen, everyone has, in the spirit of cooperation, looked at these issues. So Dr Young's going to be raising it today at the meeting of Chief Health Officers from across the nation, and it'd be nice if we could have a discussion about it on Friday. All right?
Small business,
Yes.
is the government considering another round of grants similar to the 190 million?
Oh, I'm glad you reminded me about that. So yeah, that's of course we also made available up to $10,000 to small businesses across Queensland, in total $200 million. My understanding is that second round we made sure that 50% was to regional Queensland, 50% to southeast Queensland, and happy to find out where that's up to for you, Jack. Yeah. Okay, thank you. Thanks.